Hello and welcome back to the Pain Free for Life podcast. I'm your host, Dr. Rob Vanbergen, and today I'm interviewing physical therapist Jim Heafner. Jim earned his Doctorate of Physical Therapy from St. Louis University. He's a certified orthopedic clinical specialist, and he's trained in the Selective Functional Movement Assessment and Functional Movement Screening systems. His educational and clinical background have made him an expert in manual and manipulative physical therapy, as well as functional movement. Jim opened Heafner Health Physical Therapy in February of 2016. When Jim is not treating patients in the clinic, he focuses his attention on educating fellow physical therapists in the profession, teaching manual therapy courses in Arizona and Texas, and writing. Jim has authored 3 books, including Making Sense of Pain and The Yoga Fix. Additionally, his student physical therapy-based blog attracts upward of 65,000 views per week. I encourage you to learn more about Jim by checking out the show notes. So in this episode, Jim and I cover a topic that we talk about a lot here at Pain Free for Life, which is fitness or movement and how it can be done and incorporated into your lifestyle for people both in pain and those just looking to optimize their wellness. Jim gives some specific good exercises and talks about the buildup and importance of the 5 pillars of health as he sees them, as well as essential 8 exercises to perfecting and optimizing your health.
Welcome back to Pain Free for Life, where we share how to successfully overcome all kinds of chronic and extreme conditions to live happy, productive, pain-free lives forever. And now, here's your host, co-founder, and board-certified holistic healthcare practitioner, Dr. Rob Vanbergen.
Hello, Jim. Thanks for coming on the show.
Hey, thank you so much for having me.
Yeah, so I'm excited to talk about this topic today because honestly, anything to do with physical therapy, with fitness, these are things that people are pretty afraid of, especially when they're in chronic pain. And at Pain Free for Life, we focus on what we call the #8 protocol for pain resolution. One of those 5 elements is fitness. I've tried to kind of rebrand fitness to movement in an effort to take some of the fear away. I know as important as this is for a lot of people, this is a big struggle for people in chronic pain. So how would you suggest going about structuring a weekly fitness routine for a chronic pain patient?
Well, the conversation certainly changes when we add in the for a chronic pain patient.
Sure.
If I could structure a lifelong weekly fitness routine for someone who's looking for longevity and for living a long, healthy life, someone who wants to do stuff into their 70s, 80s, and 90s, what that would look like is a strength training program of 2 to 3 times a week. So strength training 2 to 3 times a week. That usually includes 1 full body day, 1 upper body, and 1 lower body.
Okay.
Then I would include your cardiovascular training twice a week. And what that looks like is steady state, low intensity cardiovascular training. So for about 40 to 60 minutes. And so that gives us at 5 days a week right now. Then I would recommend high intensity interval training. So HIIT training 1 time a week. And that's a shorter workout. It has some carryover benefits similar to the cardiovascular training, but it hits different metabolic goals, and it is great for fat loss. It's great for conserving muscle. So we're at like 6 or 7 days right there. So we have the whole week more or less blocked out. I would also include, if you have time to do more joint flexibility or mind-body type of training with a yoga practice or some deep core training, that would be a nice addition for another day. And then what encompasses all of this is that we for sure need to be walking every day, and we need to be doing easy whole body stretches and mobility stuff on a daily basis. So like we have our main pillars of strength, cardio, high intensity interval training, some core training, flexibility. And then every day we need to be walking, and we need to be doing kind of basic human maintenance on our musculoskeletal system.
So you really need to be building this. So from a preventative standpoint, one of the best things you can do is to start to build this so that you can, as you say, stay active, stay fit, stay healthy over the course of your lifetime.
Yes.
Is there like an age to start this at, like as young as you can, or?
Oh, I would say as young as you can is the best way to do it. Now, from from how adaptable our nervous system is, you can really start this at any age. You can start strength training in your 60s and still get a heck of a lot stronger. So it's really never too late, which I know I don't want that to sound cliche at all, but we're talking about our health. I don't think there's anything more important. So like when it comes to, I think that what we need to deal with though is if you're starting a strength training program in your 50s, that's where our muscles are going to adapt a little bit slower. You might have more soreness early on. So that's where we might need, earlier I said 3 days a week of strength training. Maybe initially the person in their 50s starts with 2 days a week, where we give them more time for recovery. The tissues are a little less adaptable as we get older. So that's where we have to tweak those variables accordingly.
Okay. That makes sense. Mm-hmm. So if someone was to come to you and they had, say, chronic shoulder pain, they had shoulder surgery or something like that, obviously just letting it lie and not using it at all is probably not the best strategy. So
close to the worst. That's like closer to the worst strategy.
Right. Yeah, exactly. Yeah. So what would you kind of suggest for someone that is experiencing chronic pain? Let's say like on average, 5 years of chronic pain. Like, what would be a good place for them to start?
I would take the initial formula that we talked about and then shorten the numbers and shorten the intensity of each of those things so that it's like we know we still need some strength training. We know we still need to do cardiovascular stuff, but the intensity and duration that person is going to tolerate will be much less than someone who's young, fit, and active and who's not having pain. And I didn't want to dodge that portion of the question initially. But, I view pain as it's almost like if we wake up every morning with 100% battery, like if our brain's battery that's 100% full, if you're in chronic pain, that battery is just draining faster. So your ability to tolerate exercise, and because exercise it's a stressor on the body, it's a prohormetic positive stress, but it still is a stressor. So if you're someone who's experiencing pain, we're just going to drain that battery faster. And what we need to do is set up a program that doesn't exhaust you today where you don't feel motivated tomorrow. So, doing it at an intensity where we get you moving and we get the tissue and blood flow and oxygen exchange happening, that initially the goal is to get you enjoying exercise so we can then start building on those principles.
That makes sense. Okay. People don't want to do stuff if it is uncomfortable or makes them unhappy.
Now, and I don't want to take away from any future questions right now. So where do we start with that person where it hurts to do certain movements? For that, the answer is called graded exposure, where if it hurts to raise your arm all the way up overhead, or let's say if you have a 5-pound weight in your hand and you raise it all the way up straight overhead, well, the 5-pound weight might be too intense at first. So we can drop down to 3 pounds and see if it hurts. If it still hurts with 3 pounds, let's start with a stick in your hands where you can use the opposite hand to raise up. And then we're using some assistance to help out with it. So for me, anytime someone has pain with a certain movement, the answer is always to kind of scale back to the grade that they can tolerate. Because if something's hurting, the pain signals are going off, and then your movement pattern is going to change, and your body is not going to be able to handle the stress that you're trying to put it through. So if we can scale it back to a level your body feels comfortable at, then you're going to trust the movement. Your nervous system is going to feel like it can own that position, and there won't be this threat of injury looming.
Right. That makes sense. And so you'd said for like general wellness for a healthy person, you might be like 6 or 7 days a week of exercise. Would you still be doing like that same amount, or would you do like 3 or 4 days if you were in chronic pain? Or would it be better to do the same amount of days, but those lower intensity things?
I would say the same amount of days, but lower intensity. I would say also initially we would probably take out the high intensity interval training because HIIT training pushes you to 90 to 100% of your capacity. And that can be, when you're challenging your body at that extreme, that can be a big stress, and it requires a lot of neuromuscular energy. So if your nervous system's fatigued already, adding in a huge volume of intensity is not going to be beneficial.
Right. I think that's what a lot of people do. I think that they will hear this idea that they should start exercising and they'll push it too far, crash, and then they're like, oh, now I don't feel like I can do it anymore, or it was a horrible experience. So it sounds like, it's the slow and steady wins the race kind of idea, right? Get gradually involved. Perfect.
Yes. I always say training the body is like pushing a stone up a mountain. If you push hard 3 days in a row, you're going to get fatigued and you're likely going to have some overuse type of injuries. If you take too many days off pushing the stone up the mountain, then we're going to see weakness and atrophy set in. It's this gradual process of getting the stone to the top of the mountain.
Right. Perfect. Okay.
Mm-hmm.
So in the role that you work in, what do you see as the connection between movement and pain?
What do I see as the connection between movement and pain? Well, what's very tricky about this question is in the last 20 years, research through functional MRIs have showed us that there isn't really a direct link between good movement or good mechanics and someone experiencing pain.
Okay.
So it's, what I view it as is pain is a sensory and emotional experience. So that, there's nothing really physical in the definition of pain. So when I'm working with someone in pain, I need to retrain the sensory receptors. So we need to do movement and stuff like that to retrain their sensory system, the somatosensory system. And then we need to, from a top-down cortical level, we need to reprogram how they're processing that pain. And so I always say if we give better input on the way in, then it's easier to get a better output on the way out.
Okay. Interesting.
Mm-hmm.
Yeah. And that makes sense. I think that there is this, again, there's this big, especially in my community, there is this big kind of fear of movement and of pain. And we end up getting I say some of the worst off cases because they've tried all these different things and they maybe have been in chronic pain for 20 years. That's led to a sedentary lifestyle. So they don't move much at all, which of course means that any little amount of movement or exercise is going to feel really, really bad for them. Right.
Yes.
So it's, yeah, go ahead.
And for those individuals, let's say walking is even too intense. If walking is really triggering pain, the way to do the graded exposure approach is let's see how a recumbent bike feels, where we take away gravity and we kind of change up the movement, but we still get the endorphins and we still get blood flow moving, and we still get some of those other benefits of exercise. Or let's put you in a pool where we use some buoyancy and take gravity out of the equation that way. But those are ways where we can get the tissues moving. We can start working and rewiring the nervous system without hitting that threshold where the chronic, the pain signals are going off.
Right. So this kind of leads me into another question here is, what would you say, because obviously exercise has these benefits of building up your body's resilience, making your muscles stronger, getting your circulation going. Beyond those, exercise has more benefits as well for the mental health, for all of these things. Do you experience that a lot with your patients as well, that they just feel overall better?
Absolutely. Yes. And I live and work in Boulder, Colorado. So it's a very active, healthy place. So most of the time, my job in the clinic is to, let's say if their low back is hurting, it's to get them to, one, get out of pain, two, start them on the process of loading up their tissues again. So getting them to do squats and lunges and these kind of daily movements that we must do. But getting them to a level where then they can go out and on their own and do their full workout routine.
Right.
Which is, pretty active to begin with out here. People's baseline for fitness is like, it's much different than I grew up in the Midwest. It's a different lifestyle out here in Colorado versus where I grew up.
Right. It's kind of the same here. We're on Vancouver Island. Everyone's super outdoorsy. It's hiking, biking, camping.
Yes.
It's getting out in the world. And then conversely, I spent a bunch of my childhood in Quebec. So on the east coast of Canada. And it's it's really cold. So it's a lot more staying inside and just, living life that way. So the different lifestyles and what you see in the health of people around you is definitely different, because in these places where people are more active, they do seem to live longer. They do seem to reduce that risk of disease and illness that's coming in. And I think that's got to just be a byproduct of living a generally more active lifestyle to a degree.
I 100% agree. And Likely because I think all of these systems are so interrelated. How, when you start exercising, yes, it has these physical neuromuscular benefits, but the dopamine release, the serotonin, like all this endorphin and neurotransmitter release that happens with exercise is so good for your mind that I feel like there's so much carryover. I always say healthy habits build on themselves. If you start eating healthy, maybe you're more likely to start working out. Like, there's a trickle effect of doing healthy behaviors. And when you can start one and start implementing one of these things, then you're more likely to be able to grab on to other healthy habits.
Right. Do you ever find that anyone is so active and they got a really healthy exercise routine, but then they have these other negative habits, like maybe they eat really poorly and they think that that
Yes.
kind of offsets it?
Yes,
Yeah.
definitely.
Do you think it actually offsets it to enough of a degree? Because I've run into cyclists and things here they're like pro cyclists. That's what they do. But at the end of like doing this, like, kilometers long bike ride, they'll go and they'll grab a fast food burger and they'll sit down and they're just like, yeah, well, it just, I'm exercising right so I can do what else I want. Like, is there any truth to that?
If you view it as a calories in, calories out, then there is going to be, there is truth. If you go do a really hard workout, then you can probably eat that burger and it won't have the same negative effects as it would otherwise. But if you don't work out and then you just eat the burger, I really view things from a physical optimization standpoint. So
Right.
if I am doing a great workout, but then I just have a burger and I'm not getting the nutrients, the vitamins, the minerals, you're probably getting some protein from a burger, but you're also getting this unhealthy fats and grease and things like that. Then you're not putting the best fuel in to help you recover then for the next day's workout. And also I enjoy alcohol. I enjoy eating a fast food burger every once in a while. But for me, those things are more in moderation
Right.
because which is the age old story. I know it sounds boring, but that's the truth. Like if I would eat that all the time, then, and as I get older, my ability to tolerate that burger, it's going to sit in my body differently than if you're 18 years old and your metabolism's really fast and it can burn right through it.
Yeah.
And I think what we see, at least in American sports, is that the best of the best, if you look at their recovery plans, they're now gearing, like they spend hundreds of thousands of dollars on their health each year, both physically and their nutrition, because they know that how they're fueling themselves is equally important to how they're fueling themselves, how they're sleeping, uh, the amount of stress that they're under. All of those things really lead to how well they can play.
Yeah. It's
So
connected for sure. Yeah.
absolutely.
Okay, so back to exercises. Like there's so many different ones, right? There's so many good exercises, and there's probably some that are worse for chronic pain patients than others. But in general, people looking just to optimize their health, what would you say are some good exercises that people can perform every day? They don't have to be big, but that just might help listeners kind of look them up and get started.
I view things, if there's 8 essential movements that the body should perform every day, or that we do different versions of these exercises every day. I call them my essential 8.
Okay.
And those are the squat, the lunge, the hip hinge, which is like a deadlift type of motion. Then we have an upper body push. So that'll be a pushing or a bench press or a military press, a push press there. A pulling type of movement. So let's say you're having to open a door, that's pulling. In the gym, that looks like a row or a lat pull down as a pull exercise. And then we need to be able to carry things. We need to be able to twist and rotate. And we need to be able to efficiently walk. So locomotion is the last one. So we have squat, lunge, hinge, push, pull, carry, twist, and then locomotion or gait is the last one. I think people get scared right away when they hear squat and deadlift. Like those are, especially if you're having pain, you don't want to do those things. The reality is when you go from standing to sitting down in a chair, that is doing a squat type of motion. So I don't mean squat as loading up heavy weights on your back. I mean the mechanics of being able to sit your butt back into a chair and do that without pain. For deadlifting, if you need to bend over to pick up groceries off the ground, that is a hip hinge type of motion that your body needs to do. If you can't do those very effectively, you're going to use other strategies that likely don't use as big of muscles and they're less efficient. And that lack of efficiency puts more wear and tear on our tissues over time.
Right. That makes sense.
Mm-hmm. Now, if we're talking about exercises that people should do that are in pain, what I would say is start using some of the machines at the gym. The machines will give you way more control over movements. If you do dumbbells or barbell stuff, that's a lot more scary of a situation. So I would say starting out using a leg press, the lat pull down machine, which works your back, the row machine, which is great for your back, a seated press machine, which works your chest muscles. And then for lower body, we talked about leg press, and then there's other variations of lower body stuff. But those are some of the most basic kind of big five that you can do that target the major muscle groups, and that's going to get enough activation of your other muscles at the same time.
Perfect.
And I wouldn't, if you go to the gym and you're only there for 10 minutes or 20 minutes, still view that as a successful workout. There's nothing that says you need to be in the gym for an hour for it to be beneficial. So especially if you're someone who's in pain, by starting at a lower intensity and hitting these main movements, just getting the big muscle groups working, that's a great place to start.
Yeah. And that's really what it's about, right? Is like starting slow and building your way up to something you can tolerate. And
yes,
it sounds like, even in the day to day, people are getting some, if they're doing it correctly, just from, as you said, doing these things like bending down, picking things up, like they are working those muscles. Even going for a walk can make a difference for people. And it's what you can tolerate. We'll often say to people, like, if you don't really walk much, maybe stop by walking to your mailbox and count these little successes, because they are building a foundation for you to make bigger ones, right?
Mm-hmm. Yes. And that's where start parking a little further away at the store. If you use walking to the mailbox, see if you can do that 3 times a day. Then, you have to give yourself a baseline starting point of something. And then from there, you can grade your own progress. But if you don't know where the starting point is, it's really hard to begin the journey.
Oh, absolutely. And make that starting point achievable, because the last thing you want to do is say, I'm going to run a 5K, and there's no way you're going to make it at the beginning. Or if you do,
yes,
you'll be feeling it later for sure. Okay. So you've mentioned the 5 kind of pillars of health. What do you focus on as those 5 pillars?
Well, the 5 pillars that I don't talk about these with everybody, because I mainly talk about the movement pillar,
Sure.
the movement and exercise. But how I view health, the true well-rounded version of health for myself, is physical movement and exercise, sleep, nutrition, stress management, and then having a community around you to do that with. So those would be my 5. We have movement, sleep, nutrition, stress management, and community. And I think if you are kind of optimizing all of those, or if you're filling all of those buckets, then you're going to live a healthy life. That's going to kind of nourish your mind, body, and soul, which is the definition of total health.
Perfect. Yeah, I think that there's a lot of power in community. It's something that is very often unsung, particularly in the chronic pain world as well, because people can feel very isolated by their pain. They lose friendships. They can no longer go to family events. So surrounding yourself with people that are in these positions, even something as simple as Facebook groups, I've seen make a huge difference for people's self-esteem, to know they're not alone. They've got other people there, and they can get some suggestions and see people succeeding in different ways as well. And then, obviously, what we put into our body is what we're going to get out of it. So as you say, nutrition is important. Sleep is huge. Often people think that it doesn't matter as much as it does, as long as they go to bed at some point. But getting the right amount of sleep, managing your stress. I mean, the amount of guests I have on this podcast that are talking about stress and how stress is a killer. It's something that, we were often told for a long time to just ignore, right? Everyone gets stressed. Just ignore it, get on with it. And it doesn't help to ignore stress. but you also have to learn to manage these things. It's all about balance and management.
I completely agree. And I don't know if this is beyond what we're talking about with this podcast, but for all of these pillars, or for most of them, I use biofeedback for myself to know how stressed I am, to know how much sleep I'm getting. And I don't live and die by those numbers, but like the ring that I wear is this Oura ring. It's like a sleep tracking ring. And it tells me how I slept the night before, but it also gives me a heart rate variability number.
Right.
And heart rate variability is your internal level of stress. So, without being bound to these numbers, then I can say, okay, how I slept yesterday, how I ate yesterday, how I worked out yesterday, that is giving me this output today. And so starting, and it doesn't have to be a sophisticated thing like this, but just even mental awareness and focus on the things that you're doing in your life as a means of biofeedback to how those are helping you in the future is the number one thing that I try to teach people from a movement standpoint. And then I try to implement on these other pillars of health.
Okay, perfect. Absolutely. Great advice. All right, Jim, I think that just about does it. So thank you again for joining us today. It's a lot of valuable information here. Appreciate having you.
Thank you for having me on the show.
And to our listeners, I'm going to include all of Jim's contact info in the show notes at painfreeforlife.com/podcast. Until next time, I'm Dr. Rob Vanbergen, and you're listening to Pain Free for Life.
Thanks for listening to Pain Free for Life. Be sure to follow us, share the show with family and friends, and leave us a review on iTunes. Every time you share the show, you are helping someone take their life back from pain. Visit painfreeforlife.com for more resources, including our free guides to microcurrent, the Hache protocol and inflammation, as well as our blog and online community full of people just like you, successfully overcoming all kinds of chronic and extreme conditions to live happy, productive, pain-free lives forever. And stay tuned for the next episode of Pain Free for Life.